This question actually came from one of my patients. She's super healthy, really on top of her stuff, and she'd ordered one of those big direct-to-consumer blood panels. You've seen the ads, right? These huge all-in-one panels that promise to unlock all your biological secrets and help you optimize everything. 200 biomarkers, 500 biomarkers. It feels so cutting edge, so powerful. But what actually happens when you get the results? It almost always starts with a story just like this. A patient trying to do the absolute right thing for her health buys one of these big wellness panels. She's scrolling through the report and bam, big red flag pops up, low leptin in her case. And immediately her mind starts racing, right? Wait, leptin, isn't that the satiety hormone? Is my metabolism broken? Do I need some kind of supplement or treatment for this? That feeling of confusion and worry is totally normal. And as a result, she texted me and said, "What does this mean?" And I want to emphasize that we're going to use this example, leptin, because that's what popped up for her. But this exact logic applies to any lab result. The first thing that happens is you look up what the hell leptin is. Maybe you've heard it's the hormone that controls how full you feel after eating. And when you look it up, you'll find a very neat, tidy little story. It's the kind of thing that makes for a great Instagram post, but it's also dangerously incomplete. It reminds me of a favorite quote: "For any complex problem, there is a solution that is simple, beautiful, elegant, and wrong." The reality is that in an otherwise healthy person, that isolated low leptin result is clinically meaningless. It means nothing. And I'm not saying that in the sense of it'll be okay. I mean that literally. It means nothing. It contains zero information. It is uninterpretable. Dog barking will tell you more about your health than this lab result. And I know that sounds crazy when you're staring at a red flag on a very official looking report. So let's break down why that is. To really get why that result is so meaningless, we first have to understand the story they're selling you. And it's once again a really simple, tidy, and honestly, a very appealing story that wellness influencers and the companies selling these tests just love to tell. It's a story that's designed to make you feel like you've just uncovered some secret code to your metabolism. And the story is so seductive because it's just so simple. The simple story goes a little something like this. Fat cells make leptin. Leptin travels to your brain and says, "Hey, we're full. It's time to stop eating." Simple enough, right? So if your leptin is low, that must be bad, right? It must mean your brain isn't getting the signal and your metabolism is broken and you're going to be overeating. The fix seems obvious. You just need to raise your leptin level. I mean, what could be more logical than that, right? Well, this simple logic isn't just a story. It's a perfect sales funnel. It leads you directly to their supplements, their special diets, or their follow-up tests. It's a classic example of what I call quantified quackery. This mistaken belief that just because you can put a number on something, you should immediately try to start optimizing it. But here's the thing about biology. The simple story is almost never the whole story. So let's systematically deconstruct that simple story. We're going to walk through 4 logical traps, and by the end, you'll see exactly why that number on your report is pure noise, not a meaningful signal about your health. Okay, the first trap has nothing to do with biology at all. It's just simple math. The very act of ordering a massive panel with dozens of tests makes finding an abnormality almost inevitable. Even if you're in perfect health, it is a statistical certainty. And here's how this works against you. You see, a normal range on a lab is just the middle 95% of people. That means for any single test, there's a 1 in 20 chance it'll flag you as abnormal just because of the random chance of your body. Now, what happens when you run 20 tests? Your chance of getting at least one of those false alarms skyrockets to 64%. And at 50 tests, it's over 92%. You're practically guaranteed to find some sort of problem that you need to fix. These panels are designed to find something wrong. In this patient's case, it was leptin, but for you, it might be zinc or CRP or vitamin B or whatever else. So you're pretty much guaranteed a flag somewhere on that report, but for less common labs like leptin, this gets even worse because unlike something like sodium or glucose where there are universal, agreed upon standards, there is no universal standardized reference range for leptin. None. That low flag on the report is just based on that specific lab's arbitrary cutoff. Plus, your body isn't a static photograph. Leptin levels swing wildly through the day. They're naturally lowest first thing in the morning, which, by the way, is probably when she had her blood drawn, and they peak overnight while she's sleeping. So a single snapshot in time that completely ignores the rest of her context isn't data, it's just random noise. A lab value without any clinical context is just noise. Now, this is the issue with leptin, but it's true of many other labs as well. This is why testosterone has to be checked at a specific time of day. Other times can't be interpreted because the reference range of normal itself was created for blood that was drawn first thing in the morning while fasted. Okay, but let's just pretend for a second. Let's pretend the number was perfectly accurate and the range was perfect as well. Even then, the influencer story makes a gigantic error. It focuses only on the amount of hormone in the blood, and it completely ignores the most important part of the equation, how sensitive your brain is to that hormone signal. Let's use insulin as an analogy. For a super fit, metabolically healthy person, a very low insulin level is a fantastic sign. It shows that they're incredibly sensitive to insulin. But that exact same low number in a different person could be a sign of pancreatic failure, type 1 diabetes. The number is identical. The clinical context is everything. And guess what? It's the same deal with leptin or testosterone or anything else. For a healthy person, a low leptin level doesn't mean your hormone signal is weak. It means your brain is very sensitive to that signal. That's a sign of excellent metabolic health, not a problem you need to fix. After all, an extremely highly trained athlete and a sick elderly person may both have an abnormally low heart rate. And this brings us to our final and maybe the most important trap of all. It really comes down to the one question you have to ask before any medical test is ordered. Why are we even doing this test in the first place? This is a concept called pretest probability, and it's the knockout punch here. The answer to this question reveals the complete absurdity of ordering a leptin test on a curious, healthy adult. See, this is a test that has an extremely specific and incredibly rare clinical use case. In the real world, a doctor orders a leptin test for basically one reason: to investigate an incredibly rare genetic disease called congenital leptin deficiency. And the symptoms are unmistakable: severe, insatiable hunger, and rapid, massive obesity that starts in the first few months of life. So for a healthy adult, the pretest probability of having this condition is 0. It's just not a thing. This is as if the lab is giving men pregnancy tests. If that test comes back positive, your conclusion isn't, "Congratulations, it's a boy." Your conclusion is, this test is being used incorrectly. Why? Because the pretest probability was 0 from the start. Ordering a leptin test on a healthy adult is the exact same thing. An abnormal result doesn't mean you have some rare disease. It just means the test is being used completely outside its intended purpose. It's a guaranteed false alarm. So, after navigating all 4 of these traps, the statistical one, the measurement one, the biological one, and the diagnostic one, we can finally go back and answer the patient's question. She asked, "What does this mean?" Let's just put it all together. 1, the problem was manufactured by a test panel literally designed to find something wrong. 2, the normal range it was compared against was statistically invalid and pretty much made up. 3, the single snapshot measurement was biologically uninformative. And 4, the entire test was diagnostically irrelevant. So that number isn't just hard to interpret, it is fundamentally, mathematically, and biologically uninterpretable. It is pure, meaningless noise. So trying to fix this number isn't just a waste of your time and money, it's an action based on a complete absence of valid information. You're chasing a solution for a problem that doesn't exist. The only correct action is to ignore it completely. And this is the principle you can apply to any of these direct-to-consumer tests that promise to optimize your life when you're not having a problem. The lesson isn't just about leptin, it's a new way to think. Real wisdom isn't about gathering more and more irrelevant data. It's about having the wisdom to know what's relevant and what's not, to tell the difference between the two. So before you ever try to optimize a number from a lab report, you have to ask yourself the most important question: is this actually data, or is it just noise?